Hello, my name is Angel Cantos. I'm going to talk about acute kidney injury in patients with cancer. Definition. Acute kidney injury is a significant complication in patients with cancer and associated with high morbidity and mortality. Rates of AKI vary in cancer patients on the basis of several factors, including type of malignancy, either solid tumor or hematology.
Acute kidney injury, or AKI, is when the kidney is not functioning at 100%, and that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF, but AKI is a broader term that also includes subtle decreases in kidney function. AKI can essentially be split into three types. Pre-renal AKI, meaning the cause of the kidney injury is coming before the kidneys, post-renal AKI, meaning after the kidneys, or intrarenal AKI, meaning within the kidneys. Watch the full video on osmosis.org.
Applications in medicine. The long-term consequences of AKI in the patient with cancer are highly variable, and it's likely that overall severity of illness, age, and functional status contribute significantly to prognosis in this type of patients.
There are two major types of acute kidney injury. There's blood flow mediated through things like shock and trauma, and then there's non-blood flow mediated through nephrotoxins such as cisplatin that directly target the tubules of the kidney. My lab's really focused on developing new therapeutics, really interested in looking at cell-based therapies. So at the moment, we've actually been targeting these endothelial cells that are critical for repair after acute kidney injury. And we believe that if we can insert these at the time of injury, that they can potentially be used as a therapeutic for patients to repair after acute kidney injury. The other work we've been doing is looking at mediating critical genes, and one of those that we're looking at is sirtuin-5. So we've actually found that when we knock down sirtuin-5, that this shuttles fatty acid oxidation away from the mitochondria where you produce reactive oxygen species, which is deleterious to the kidney, towards the peroxisome where you don't get ROS production, and this leads to protection. And we're hoping to harness this particular mechanism as a therapeutic that could be used to any patient that is seeing oxidative stress through the proximal tubule. Here at the University of Pittsburgh, we've actually been lucky enough to be part of a new NIH initiative where it's the Kidney Precision Medicine Initiative, and this is looking at getting biobanks of acute kidney injury tissue, which there actually currently isn't one of. And we were lucky enough to get one of these proposals, and in the coming 5 years, we will actually be generating a biobank of acute kidney injury samples.
Pros and cons. Pros: various diagnosis methods, better results in rapid diagnosis. Cons: the outcomes of cancer patients with AKI are affected by several factors. Some cancer chemotherapeutic agents are cleared by the kidney. AKI alters the pharmacokinetic of these agents, which may lead to toxic levels.
Why are we worried about acute kidney injury? Kidneys ensure that the body fluid levels are regulated and that waste products and toxins are effectively removed from the blood. Acute kidney injury, or AKI, describes a rapid decline in kidney function over a period of days. AKI is usually diagnosed based on a rise in creatinine, a serum marker of kidney function, or a fall in urine output. What causes AKI? The most common cause of AKI is a reduction in the blood supply to the kidney. This can happen for multiple reasons, but it's most frequently seen in patients who are dehydrated or suffering from infections, especially if they are taking medication that can potentially reduce kidney blood flow, such as diuretics, for example frusemide, angiotensin-converting enzyme inhibitors, such as ramipril, or non-steroidal anti-inflammatory drugs, such as ibuprofen. Given these risk factors, it is no surprise that acute kidney injury is a common condition in hospitalized patients. Studies suggest that up to 1 in 5 emergency admissions to hospital will have AKI. Why is AKI important? AKI is a serious medical condition with a mortality rate of between 30 and 40% for the more severe cases. In most cases, acute kidney injury is treatable. However, a good outcome hinges on early recognition and timely treatment. What treatments are available? In the majority of cases, the treatment of AKI is relatively simple and involves withholding potentially damaging medication and the administration of intravenous fluids. It is vital that these interventions are administered early to minimize the risk of acute kidney injury progressing to a life-threatening stage. As well as timely intervention, it is imperative that patients with AKI are monitored for signs of deterioration. Fluid balance monitoring in particular is of crucial importance, as the urine output is a good marker of kidney function. What is AKI Pro? AKI Pro is a program to improve recognition and treatment of acute kidney injury. Ward teams will get extra reminders about deteriorating creatinine levels. By using a specifically designed urine output measurement tool called the wheel, we will improve the quality of output monitoring. Patients will be able to help. We have written information, and the Kidney Safe bracelet reminds patients, carers, doctors and nurses to monitor quantity and quality of the urine. We're using nationally collected lab data to analyze trends in the prevalence of renal failure. With your help, we're hoping to give patients better fluid management, safer prescribing, improved urine output monitoring, and earlier repetition of abnormal tests. If you want to get involved or discuss AKI Pro, please get in touch with your local renal champion or email us at christian.subi@wales.nhs.uk.
Issues applied in Ecuador. The incidence of acute kidney injury, which is common in patients with cancer, depends on the type and stage of cancer, the treatment regimen, and coexist condition.
This is Doug Brunk for Global Medical News Network, reporting from the annual meeting of the American Society of Nephrology in Denver. In what is believed to be the first study of its kind, researchers from MD Anderson Cancer Center evaluated the incidence, risk factors, and outcomes of acute kidney injury in cancer patients.
We know that acute kidney injury is on the rise, but little is known about its incidence or outcomes or risk factors in patients with cancer. So we, working at MD Anderson Cancer Center, looked at admission of patients into the cancer center over a 3 months period in 2006. We found that the incidence is much higher than compared to the community admission of patients for medical reasons. Cancer patients had about 28% acute kidney injury during the hospitalization. That included 14% who had when they were coming into the hospital, and 14% who developed acute kidney injury while in the hospital. Again, little is known about the outcome of these patients who developed acute kidney injury. And what we found was that patients who develop acute kidney injury, the cancer patients in the hospital, has about 5-fold increased odds ratio for mortality they're all 3 times more likely to stay in the hospital as well. And there are certain key risk factors were identified, such as the presence of sepsis, the utilization of antibiotics, the presence of hyperglycemia. So all these are indicating us that we may be able to look at these things more closely, may be proactive in identifying these risk factors and to see whether we can reduce the likelihood of developing acute renal failure in the cancer patients admitted in the hospital. The hope is that doing so, we may be able to reduce the higher mortality associated with acute kidney failure.
Conclusion. Through evaluation to assess for general and cancer-related etiologies can assist in forming a treatment plan that best addresses the patient kidney and oncologic disease. Thank you.